let's get 2 minutes on the clock, and of course your time starts now. All right, time is up. Let's get to those answers. So here we have a 22-year-old female. We have a case of chlamydia. What we're wanting to know is, do you know those non-pharmacological, those really important, more kind of social things that we need to cover when we're talking about these kinds of infections? For this, I really hope you're using the Australian STI guidelines, but you will find they marry up quite nicely to things like electronic therapeutic guidelines, as I know most people also use. So what are these important things? Advise no sexual contact for 7 days after treatment is commenced, or until the course is completed and symptoms are resolved. In practice, we say whichever one is later, but I think as long as you're specifying one of those two, you're going to get those marks. I wouldn't be specifying both. Why could that be? Well, I think you'd be probably delving into the realm of overcoding there, in which case you'd be losing those marks there. So again, if you do have these kinds of situations where it is one or the other, only specify one for your answer, because that's then showing, yes, you're aware of these guidelines, you know what to be doing there. Now, encourage contact tracing for sexual contacts for the last 6 months. And it's really important you do specify that time frame there. It's the 6 months that really makes this response to undergo testing of exposed anatomical sites. I'll let you think of what that might entail. And of course, these are all going to be worth 2 marks here. Now again, consider presumptive treatment of partners if there has been sexual contact within the last 2 weeks. And again, this is one of those kind of two-part things. I would just be choosing one on the actual day, or when the person's individual circumstances mean later treatment may not occur. Getting 2 marks there. Advise no sex with partners from the last 6 months until the partners have been appropriately managed. Pardon me. Now, some could argue this is probably a little bit too similar to some of those previous answers. It is subtly different enough and is a specific separate point on the STI guidelines, and so I think you probably would still get 2 marks here. This may be one of those cases, though, where they say maximum 6 marks or maximum 8 marks for the case itself. Now, of course, you're also going to be providing the patient with a fact sheet given the complex instructions. Again, always nice to specify why you're doing things. So just give them a fact sheet. May not really be worth many marks, but acknowledging that this is complex information, it gives you that little bit more credibility and again shows that consultant level expertise and knowledge. And of course, chlamydia is a notifiable disease. This may vary state to state, but you should be notifying the state or territory health department. A lot of labs do this automatically, but always make sure this has occurred, as we do want to be able to keep track of the prevalence of these kinds of conditions. All right, now, just like chlamydia, it's the gift that keeps on giving. We have more questions for you tonight. Let's get 2 minutes back on that clock, and your time starts now. All right, time is up, and let's get to those answers. Now, this is one of those questions where you might be thinking, oh, this is an easy one, I know this one. Or you might be sitting there thinking, oh boy, I don't know. What do I think I'm going to do? Sometimes you will have those questions where it's either you know it or you don't know it. If you do know it, fantastic, throw that answer down, move on. You've potentially just scored yourself, 2 minutes to use elsewhere in the examination. So if you do follow guidelines, this is doxycycline orally for 7 days. They have specified dosing is not required, but I feel like just for opportunistic teaching, we will let you know this is 100 milligrams BD for that 7 days. Or if you're worried about adherence or doxycycline is not a valid option, you can use azithromycin orally as a single dose. This is 1 gram, again, dosing not required, but for that little bit of teaching, 1 gram. And either of those options will give you 2 marks. Hopefully that makes sense. Of course, we're going to treat this thing. But, chlamydia keeps on giving. What is the next thing we may have to do? If only we had a question to ask. Let's get 2 minutes back on that clock, and your time starts now. All right, time is up. Let's get to those answers. And this is one of those things you'll see in the actual exam here where they'll give you 2 questions around one topic and then kind of switch it up a little bit. It still applies to that patient there, but is to assess maybe a different facet or different domain of knowledge relevant to that individual. This, without showing any gender biases, tends to be a little bit more common in our female patients. And I think a part of that is just often there's more things that they're trying to examine on, or they're trying to make sure you have some level of knowledge on for that patient, for that condition, for that situation there. Now, of course, this is asking about contraception in a 22-year-old female. What options do we have here? So, of course, we're going to be looking at our UK MEC guidelines, our Category 1, 2 and 3 and 4. And for these ones, the ones that are going to be applicable is our Category 1 and 2 here, which is going to be the copper IUD. I think a lot of people forget that it exists, but it is a fantastic way to protect against unwanted pregnancy. It has that benefit that you can kind of leave it in for pretty much as long as you want, providing there's no complications. Of course, we have the Mirena, the Kyleena. For the examination, you may wish to spell that out a little bit more, but they have confirmed it in the marking rubrics that you can use the brand names for things like this where it may be easier or simpler, rather, to write Mirena or Kyleena. So that is, of course, the levonorgestrel releasing intrauterine system. We also have our progesterone-only implant, our Implanon. Again, that would accept that brand name. And the progesterone-only injectable, so depot. You may not get the marks if you just say depot injection. I think that'd be a little bit specific as to the examination, the examiner marking your exam. Yes, I think they would understand what you're saying. You may get maybe only half a mark. Again, don't forget this is a consultant level, a fellow level examination. We do really want to see that little bit of extra polish there. Of course, there's the progesterone-only pill, POP, also gives you a mark, but the one thing you should not put on here is the combined hormonal contraceptive, or COCP. The reason being we have specified in that stem there that she gets migraines with aura. This means COCP is not an option. It is a condition which represents an unacceptable health risk if the method is used, our UK MEC 4, and so if you put that down, not only will you not get that mark, but this is considered to be one of those killing answers, which means you get 0 marks for this entire question. Not the case, but for this question. Keep an eye out for these kinds of things. There's little traps like this that you will find scattered throughout. Make sure you don't fall for these traps here, because you might put all the other answers down with expertise, make one little slip, and it ruins all those fantastic marks for you.